So why do teeth, like why teeth can become stained over time? Why do they even somewhat adjust or change in color? Number one, with aging, the teeth color can actually get somewhat darker, and that's natural with aging. If you look at a much older person's teeth compared with a very young individual, you will see a difference even if you look at the same person when they were very young versus very old. Number one is natural aging in relation to the tooth gradually changing its color. That's a natural thing. It happens over a very long period of time. Poison drinks like coffee, tea, even pastas, sauces that are used, all of these things can actually cause some discoloration or changes in the colors of these. So foods and drinks also may have some components that can affect the teeth color. So today's topic is teeth whitening, how to make the teeth whiter. Before I get into how to make the teeth whiter, we need to understand why do teeth get discoloration in the first place? Because even if someone gets a really good teeth whitening and they're happy with the results, these teeth may get discolored again very easily if they don't know what's causing the discoloration of the teeth. Okay, so coffee, tea, certain foods and drinks, foods with sauces like pasta with a red sauce, all of these things can discolor the teeth. I drink coffee on a regular basis, but I rinse afterwards with water, rinse and spit. Um, Again, I don't have too much. I have 1 or 2 cups a day, sometimes more, depends on the day. Okay. Of course, smoking is something else that leads to tooth discoloration. So just letting you know, I personally absolutely despise, meaning hate, smoking. So, but anyways, it's really bad for oral health, the gums, the also health of the tongue, and it on top of all of this, it does contribute to discoloration of the teeth. So certain medications, some people may get confused. Wait, what do certain medications have anything to do with teeth discoloration or something? That's actually true. So I'll just give you a simple example. There's something called as tetracycline stains. Tetracycline is an antibiotic. And the weirdest part about this, something really interesting. So if there was a pregnant woman and she took tetracycline, there's risk that the offspring, meaning the baby, would have discolored teeth. Okay, so that's why for pregnant ladies, we do not describe tetracycline to avoid this. Okay, so it's called tetracycline teeth, tetracycline stains, and people who have these know very well about them, of course. Talked about natural aging, food and drinks, certain medications, smoking, coffee and tea. Okay, these are basic things that contribute to the staining or changing in the colors of the teeth. Okay. Right. So there are different types of teeth whitening and different ways that the person can get whiter teeth. So there's something called as in-office teeth whitening, and I talk a lot about this. So this is the Zoom whitening, the laser whitening, the teeth whitening that happens at the dentist's clinic. So this is a type of teeth whitening that's very common and prevalent. There's also another type of teeth whitening, and that is called at-home teeth whitening. At-home teeth whitening can happen in different ways and using different techniques. So one way is a dentist may prescribe certain whitening trays and materials to help with it. Let's get the likes up in the stream. We have a lot of people here in the comments. What are you waiting for? Put some more likes on the stream. I appreciate it a lot. Thank you everyone who's liking. We'll go. So subscribe to the channel. You will see the streams also getting much better, hopefully. So I talk about at home, and the dentist may be prescribing certain trays or teeth whitening material for the patient to do, and this will happen under the supervision of the dentist. So yeah, these are at-home kits from the dentist. I really like those because they're prescribed by dentists. Normally they happen. Yes, it's like that. The at-home kits from a dentist are great because they are done often at the under the supervision of a dentist, and this person will follow up with the dentist. It's one of the ways. It has some problems, of course. It needs the patient's compliance to actually use the trays They need to use them properly. So this is one of the ways for teeth whitening at home. You cannot believe how many times I get asked, what about teeth whitening at home? What about teeth whitening at home? So I'm telling you what are the methods. Now, there are over-the-counter products, like whitening strips or whitening toothpaste or gels, all of these things. I would argue they're perhaps it's convenient, of course, but they're maybe less powerful. They may have less of an effect in comparison with in-office teeth whitening or teeth whitening kits under the dentist's supervision. Okay, so I'm giving you what's out there so that you will have an idea when you're thinking about teeth whitening. So how does the teeth whitening itself even work? Okay, we get it. You just yapped for an hour about the teeth whitening methods and what causes the discoloration for the teeth. Well, the teeth whitening material, they have active ingredients. These are hydrogen peroxide based. There are also some other active ingredients that helps with the teeth whitening. Okay. With regard to the teeth whitening process, it happens typically over time, and it can happen over a session or over multiple sessions, which is very, very important. Okay, which is very important because let's say there's a tooth at a very discolored state. It may take a couple of sessions before that tooth reach the most desired outcome. So that is very, very important in relation to teeth whitening. So it's not a one-off thing, and there you go, everything is fixed. Now, veneers, on the other hand, of course, there are some visits to get the veneers, but from preparation to receiving the veneers, it's like few visits and the change happen. And also with veneers, we can sometimes make slightly more aggressive change, and with even crowns, when indicated, of course, because crowns are invasive, we can make even a more aggressive change with regard to crowns. Okay, but veneers and crowns, it's something else. We will talk about it on a separate stream. So we also talked about how whitening works, which is very important. Okay, what about the safety? Actually, there are some safety concerns, especially in relation to heat sensitivity. So I will discuss now some risks in relation to keep whitening that people need to understand too. After getting keep whitening, considering the methods that I discussed, there are some risks in relation to teeth sensitivity. There's actually a lot of people that may get teeth sensitivity with teeth whitening. And the more aggressive the approach and the more material that was used, the more intense the method, the higher the likelihoods for teeth sensitivity. And the more likely teeth sensitivity can happen. By the way, everyone, like up on the stream. If you're not subscribed, what are you waiting for? Click on my name, subscribe to the channel. I will be doing more even live streams. So far we addressed a number of things. Really good so far. Okay, so there's something very important. So we talked about why do teeth get discolored. Number 2, we talked about what are the methods for teeth whitening. Number 3, we talked about how the teeth whitening even works. Number 4, we talked about the safety concerns and risks in relation to teeth whitening, although perhaps not necessarily major, but they do exist. Now I'm going to talk about maintaining the shade that you achieve, or trying to maintain the beautiful smile, hopefully, that was achieved at the end. With regard to maintaining a bright smile, especially after the whole teeth whitening thing is done, there are a number of things that need to be taken into consideration, okay? Number 1, of course, the thing that's gonna sound a cliche that I'm gonna say, and that is brushing often, and also using dental floss regularly, not only for oral hygiene purposes, but also for aesthetic purposes and for maintaining the beautiful smile that was achieved, okay? To limit the staining foods or stain-causing foods and drinks, try to limit their frequency or reduce their consumption. I know a lot of people may love coffee or tea. It doesn't need to cut them out completely, but to reduce the consumption and the frequency of consumptions of them. Welcome, Bold, my friend. Welcome. Right. Let's get the light up on the stream. We have also live stream goal here. It's out of one only. Hopefully we can achieve it today. If we achieve the goal, I will do more live streams like this and I'll live stream for longer. Okay, so there's something called as touch-ups in relation to teeth whitening treatments, meaning let's say someone got teeth whitening, they may follow up with the dentist every 6 months or every 12 months to get something called as a touch-up to keep in an event if like the teeth got darkened a little bit from the result that was achieved. The touch-up further enhances the result, or at least keeps for it's for maintenance purposes, maintaining the result that was achieved. Okay. Of course, with regard to smokers, they're gonna be mad at me after this video, but avoid smoking if you want long-lasting results. And honestly, try to cut off smoking completely. It's very bad for the gums. It's very bad aesthetically for the teeth. So just try to cut it off. Right. So there are also some people that need to be cautious when approaching or when thinking about teeth whitening, and these are especially people with a lot of dental fillings, people with a lot of cavities, people with gum disease or periodontal disease. These take priority before aesthetic needs and aesthetic demands. So if someone came with a whole ton of cavities and so much gum disease and their gums are red and puffy and like inflamed, well, yeah, that had a priority over the teeth whitening. And you may be surprised, but that actually does happen. So there are people that visit the clinic with the gum disease, with a lot of cavities and fillings, and they want teeth whitening. Well, these problems take priority, and ethically the dentist should address those oral diseases and dental problems prior proceeding to aesthetic treatments and aesthetic issues. Now, it doesn't mean that the dentist disregards the aesthetic needs or the aesthetic demands of the patient, but there are priorities when it comes to the treating. The priority would be the dealing with the cavities, dealing with the gum problems, all of these things, getting them healed, and then proceeding with any aesthetic treatments like teeth whitening or veneers, all these things. Okay, so you can, by the way, write questions. I'll go over some questions asked, or you can talk about any topic. You can say hello, let's chat. Also, not every person is indicated for teeth whitening. Even if someone did not have fillings or did not have cavities or didn't have gum disease, that person may still be not indicated for teeth whitening because their case may need an alternative solution. And an alternative solution like what? An alternative solution like, for example, veneers or other aesthetic options. So just to be clear, so it's not only teeth whitening that's available to enhance the aesthetic, but also there are many other options that may be used or may be available.